off, what is the status of this patient at this time? Do we have an update on his condition?
Yeah, so the patient currently remains in a stable condition. There's been no change from the condition that I reported yesterday.
Anyone else if he exhibited symptoms on the flight, why he was not admitted to hospital until Thursday?
So that would be a question to ask public health. I can tell you that since the patient arrived at Sunnybrook, they were immediately identified using our existing processes, which we have for identifying any patients with any respiratory symptoms or fever. And we always screen patients for recent travel, and they were immediately placed in the appropriate precautions.
Was he actually symptomatic on the plane? Because we heard differing answers to that yesterday at the news conference.
So I can tell you that the patient was identified when they arrived at Sunnybrook because of the respiratory symptoms at the time that they presented, and that was enough for us to use the appropriate precautions when the patient first contacted the healthcare system.
Has anyone else gotten sick? Has anyone else gotten sick? I know that he was in close contact with his family. Has anyone else reported themselves to?
So he is the only patient that we're caring for at Sunnybrook at this time.
We understand the patient is 50 years old. Can you tell us where he's from in the Greater Toronto area?
So that is not information that I can share with you. That is personal health information.
Did he go anywhere else?
And the time of the flight?
Did he go anywhere else from the airport to his home and then to Sunnybrook, anywhere in between that might be a concern to members of the public?
The information that has been shared with public health is that the patient returned from Wuhan with one connecting flight in China directly to the Toronto airport, and then took personal transportation back home.
But then from there, never left his home, and on Thursday came straight to the hospital here by ambulance?
From the time that we identified the patient, we always work with public health, and we have been liaising with public health for any such patients that could be considered under investigation, and they've been instituting home isolation practices for those particular individuals, and that's standard practice.
What I'm getting at is between Wednesday, when the man arrived here in Toronto, went home, and then Thursday he went from home here to Sunnybrook, do we know if he went to the grocery store, anything of that sort?
So again, those would be questions to ask public health, as they are, that is sort of in their jurisdiction to be looking at any contacts in the community.
CNN is saying that people are contagious before they're even symptomatic. So what is the risk to the people who are on that plane with him?
So again, that would be a question for public health in terms of the risk related to the plane, because they have all of the information related to the aircraft, where people were sitting, and I know that they're performing an investigation right now.
Can you confirm to us which flight he was on? We've got word that he was coming in, they said yesterday from Ontario. Was it 3:30, 3:45? What plane was he on? Because people in the viewing audience want to know if they were on the flight with him.
So I don't have information about flight information, and again, that would be a question for public health.
What time did he report and come to hospital on Thursday?
So the patient presented to Sunnybrook on January 23rd, and as I've mentioned, they were already identified in advance because I think that they were under surveillance, and again, emergency services were notified, took all the appropriate precautions, and we identified the patient immediately on arrival using our existing processes that we've had in place.
Morning, afternoon, evening, what time of day was it? How long after his flight landed do you think he came here?
So again, the patient presented in the evening of January 23rd to our institution.
Quick
Dr.
question
Leis,
here,
if I can
Mr.
just
Leis.
ask
Mr. Leis, quick question. Are you guys assuming that patients are contagious while asymptomatic? You're responsible for infection control here.
Yeah.
What's your assumption?
So we continue to be aligned with public health, locally and also provincially and nationally, the Public Health Agency of Canada, and we're using the established screening criteria, which is based on the presence of respiratory symptoms or fever. We're also working with the WHO as they perform their investigation, and we will certainly be extremely vigilant in reassessing our practices. But right now, the approach that we're taking allowed us to identify this patient immediately, place them in the appropriate precautions, and I think that's a sign really that our system is working.
But in layman's term, does that mean that, in your opinion, maybe not specifically to this case, but in your opinion, does that mean that persons who do have the virus are contagious without being symptomatic?
Yeah, so at the moment there is not strong evidence that that's the case. We're still learning about this particular virus, and in fact, I know that that is a question that's currently being actively reviewed.
Dr. Leis, I want to clarify here a second if I have a question here. Anyone else who is exhibiting symptoms around the GTA where there is a concern amongst public health that they may have the coronavirus, will they be brought here or will they go to their local hospital? Is there this feeling that this is a centralized, or is that practice that this is a centralized location?
So we completely understand that there's a lot of anxiety and questions in the general public, and that is very understandable. I want to be absolutely clear that that individuals who have questions or anxiety, the first reflex should not be to go to an emergency department, and certainly Sunnybrook is not is only one of many hospitals in the province. The first point of contact should be with public health if there are questions or concerns. Of course, if patients are acutely ill, then they should proceed to the emergency department. If they have a history of recent travel or potential risk, then it would be important to notify emergency services so that they can take the appropriate precautions.
Would a potential case be transported here from a hospital in their jurisdiction? I mean, if someone is presenting symptoms and a hospital in, let's say, York region thinks that someone in their care has coronavirus, would they be brought here or treated at their local hospital?
So that would be a question for public health and the direction and the ministry in terms of how they are going to approach the situation. At the moment, at the local hospital level, we are prepared and we're ready to identify patients who would present to our hospital, and people should be addressing their questions to their local public health unit.
We were told that his family is in self-quarantine right now. They're in self-imposed quarantine. We're also told that the average incubation period for this is 3 to 6 days. So how much are you expecting for his family or other people to be coming here? We're hearing just from reports that the average person is infecting 2 to 3 people.
Yeah, so public health has people on the ground to have individuals in the community that could potentially be at risk be in home isolation.
Dr. Leis, how do you treat this? I mean, is there some vaccine? If someone has this, what do you do?
So at the moment, there is no treatment, as is the case for most viral respiratory infections. There have been some groups already early on looking at potential experimental treatments based on the experience that we have learned for other novel coronaviruses, including MERS back in 2012.
But for this gentleman, when does he get released? I mean, you have to be confident at some point that he's no longer suffering from this infectious disease?
For now, the mainstay of treatment for these cases is supportive management, and we are taking every precaution to monitor the situation. As I've mentioned, the patient is currently stable and will definitely be continuing to maintain the same precautions and observation until we can be confident that there is enough improvement and that the patient is no longer at risk of transmitting to anyone else.
What's the mortality rate, Mr. Leis? What's the mortality rate? Do we know that?
So we don't know, we don't have an accurate assessment of the case fatality, because at the moment we don't, if you look globally, there are probably some cases that are less severe that haven't been detected. The data that we have is biased towards the patients who have been identified, and mainly in other countries those have been in hospital settings, and so they are the more symptomatic and severe cases.
And what
How
would
long
be
do we
the
normally
rate?
stay in hospital for? How long is it the course of treatment normally last?
Could you repeat the question?
Can you just tell us how long the course of treatment normally lasts? How long someone is normally in hospital when they are hospitalized for this?
So, again, we're still learning about this virus. Our plan is to certainly maintain the same precautions and continue to repeat testing and work with public health, and the patient will not be discharged until we can be assured that they have fully recovered.
And how concerned do you think the general public should be? Because there's a lot of panic in hysteria out there at this point.
So again, I realize this is the first case in Canada, and we were able to promptly identify this particular individual and make a diagnosis, again, because we have the systems in place to do so. I think the general public, needs to understand that, again, the risk remains low. This has been reiterated multiple times. We are continuing to follow the situation closely, but the fact that we have identified this first case, again, is a marker of success of the system that we have in place and all the progress that we've made since SARS.
Doctor, I hear what you're saying here, but we see, on social media, people tweeting at Sunnybrook Hospital saying, you know, my wife is due to deliver there in a few days. Can I go to another hospital? I'm sure you're getting a lot of those inquiries.
So we are carrying on our normal business and normal operations here at Sunnybrook. And we are able to care for this patient because we have established processes in place, and it is not affecting the care that we provide for all of our other patients. Thank you very much.
Like, what